How's it going, guys? We have a past level question for pathology. 49-year-old man, 4-month history, gradually worsening fatigue. He's lost 5 pounds during this time. No past medical history, works as a carpenter, so he has exposure to sun. His vitals are normal apart from blood pressure that's borderline, 160. BMI at 24, fasting glucose normal at 80, should be 72 to 99 fasting. 100 to 125 is impaired fasting glucose, pre-diabetic. 2 measurements, 126 or greater fasting. Diabetes mellitus, any 1 random glucose 200 or greater diabetes mellitus. HbA1c 6.5% or greater diabetes mellitus. He has darkening of the skin of the forearms, could be due to a myriad of causes. Could be something like pellagra, nice insufficiency. Could be hemochromatosis, where you've got bronze diabetes. It could be Cushing's syndrome. It could be adrenal insufficiency, Addison disease. It could be in females, things like melasma. So there's numerous causes when we think of darkening of the skin. Serum ACTH is elevated, which the following most likely seen in this patient. Choice A, decreased corticotropin releasing hormone. It's wrong because this is CRH, and our patient has Addison disease, which is idiopathic primary adrenal insufficiency, where the zona glomerulosa and fasciculata stop producing aldosterone and cortisol respectively. So the low cortisol means we have decreased negative feedback at the hypothalamus anterior pituitary. CRH goes up from the hypothalamus. That causes POMC, pro-opiomelanocortin, to go up, which is the precursor to both alpha MSH, which is why we get hyperpigmentation and adrenal insufficiency, as well as ACTH, which goes up. And then the high ACTH is attempting to make the zona fasciculata make more cortisol, which we can't because we have primary adrenal insufficiency. So the low aldosterone means that we're going to have low serum sodium, which is why choice E is wrong, because sodium is 135 to 145. So you can absolutely have normal serum sodium in adrenal disorders, high or low. Okay, that's an important point I've discussed before. But here, the sodium is clearly high, which is wrong. Okay, so sodium would be low, and because you're not reabsorbing it in the cortical collecting duct of the kidney under the action of aldosterone. Potassium would be high because you're not secreting it. Okay, so 3.5 to 5, so we expect serum potassium to be greater than 5. And we'd have a metabolic acidosis, biocarb 22 to 28, so we'd expect 22 or lower. Okay, but because we're not secreting protons distally, that's our classic derangement for Addison disease. So let's just hop to the others here. We haven't gotten to the correct answer yet. So choice B, eosinophil, is 15% correct answer. Now, if this is the first time you're hearing this, sounds very weird, but it's not. I made clips on it. One of the highest yield causes of eosinophilia on USMLE is adrenal insufficiency. And it's because cortisol plays a role in helping to sequester eosinophils within the spleen, in addition to helping to induce eosinophil apoptosis. So you can get high eosinophils in the setting of adrenal insufficiency. They'll give you a vignette of Addison disease. They'll tell you eosinophils are 23%. And students are off chasing stool, ova, and parasites, thinking it's a helminth infection. It's not. Okay, so you got to know that adrenal insufficiency can cause high eosinophils for USMLE. They really like that. All right, so let's just look through the others. Failure of suppression with high-dose dex is wrong because this refers to Cushing syndrome. It has nothing to do with what we're looking at here with Addison disease. It's a long seminar when we talk about the dexamethasone suppression test. Okay, if the most common cause of Cushing syndrome is exogenous steroids, we would not do a dex suppression test for that because clearly the cause is the exogenous steroids, but for endogenous causes, we can do the dex suppression test. Now, the phrasing Cushing syndrome refers to any cause of Cushingoid appearance. It could refer to exogenous steroids. It could refer to ACTH secreting tumor of the anterior pituitary. It could refer to small cell bronchogenic carcinoma secreting ACTH. It could refer to zona fasciculata tumor secreting cortisol. Any cause of Cushingoid appearance is called Cushing syndrome, but Cushing disease refers to only anterior pituitary tumor secreting ACTH. So if we have a patient walk through the door and they've got an anterior pituitary tumor secreting ACTH and they look Cushingoid, we would say that patient has Cushing syndrome due to Cushing disease. Now, in terms of the test, the high-dose dex, only Cushing disease will suppress with high-dose dex. So if there's failure of suppression with high-dose dex, we know it's not an anterior pituitary tumor secreting TH. So we say, well, is it a zona fasciculata tumor secreting cortisol, or is it small cell bronchogenic carcinoma secreting ACTH? Well, if ACTH is high, we would know that it's small cell bronchogenic carcinoma. If ACTH is low, it's suppressed, we would know it's the zona fasciculata tumor secreting cortisol. Now, our fasting glucose here is normal. That's how we know it's not Cushing's. Cushing's, you get insulin resistance with diabetes. We would give you a high fasting glucose. Okay, and also you tend to gain weight with Cushing's rather than lose weight. We would mention central obesity, the whole buffalo hump, purple striae, they love that. You can get peripheral wasting, but you're ultimately going to get central obesity, weight gain with elevated glucose. Okay, because you can get hyperpigmentation with Cushing's. That's not what we have here. Wrong fucking answer. Choice D, hilar lesions, wrong, because if we wanted to just state the possibility that this is small cell bronchogenic carcinoma secreting ACTH, well, we just said that we would have high glucose if this is Cushing's. We'd expect weight gain. Wrong fucking answer. Choice C, of course, they don't have to mention he's a smoker if they want to be vague, but obviously smokers are who get small cell. Serum sodium 147, we already harped on. It's wrong because you're going to have low serum sodium, usually in the setting of adrenal insufficiency, never high serum sodium. Wrong fucking answer.